whilst there's the worry to be able to get hold of as many people, because there's been so much progression in an advancement through the various programs over the years, that it's frightening to see that we're losing a lot of that ground. So obviously we all want to be in a position where we can catch that back up again. But moving forwards, I'd be interested to hear what kind of new strategies you might be implementing now that could actually play a positive role further down the line, if you can identify any of those.
One thing one thing we used to do in the past is we were able to send people from different countries around the world on a specific mission. Obviously, this is not possible anymore. So it has opened, I think, an opportunity. And I really see it as an opportunity, is how can we build a more global, what we call in our organization, an ambassador program, which would basically enable people to know about the cause, because not enough people know about actually eye health condition. People know about poverty, climate change, but we need more people in each country to be aware of access to vision care.
It is an opportunity we are seeing here, like with all this campaign on washing hands, etc., that is going on, maintain the hands cleaned, etc. We are seeing an opportunity to add on this and put there a face washing also in the schools.
That's absolutely valid, because certainly in the countries that I've visited through IAPB and Queen Elizabeth Diamond Jubilee Trust, you know, and Orbis and things, I've seen so much, so many issues being caused by lack of hygiene, and of course then when there are programs that have combined with other organizations, whether it be Sight Savers and you know, and Water Aid, for instance, you know, the effects that it has on the reduction of some of these eye diseases is dramatic. So I think it's an incredibly valid point, that actually hopefully with some of these simple measures, that actually it will be, you know, in another 10 to 15 years time, it'll be interesting to see the figures, to see how much impact these measures may have had on the ground. Simple stuff like this right now, which you take for granted, that, you know, we're concentrating on a virus, but actually this is going to have a good effect for other reasons, on things like on eye conditions, which is a positive.